Hi, I'm S055, a postdoc at the Medical University of Vienna, and in this video I'm going to provide a brief overview of our work on learning retinal representations from multimodal imaging via contrastive pre-training. Although deep learning techniques have achieved remarkable advancements in numerous domains, their progress is impeded by the scarcity of extensive label datasets. To tackle this problem, self-supervised learning techniques surfaced which can learn useful representations without the need for manually annotated labels. This is most commonly done through a pretext task or contrastive learning. The embeddings in turn can be used in a variety of downstream tasks such as image recognition or zero-shot classification. Most approaches, however, usually focus on a single data modality and are not easily adaptable to multimodal data. In ophthalmology, large multimodal datasets are readily available as modern scanners acquire both 2D fundus photography or near-infrared imaging and 3D optical coherence tomography or OCT at no additional cost. The two modalities provide a comprehensive account of the retina structure. Therefore, jointly modeling the two would facilitate disease progression modeling and personalized patient management. Despite this, multimodal representation learning in this field remains largely unexplored. In the vision language field, however, multimodal contrastive learning methods such as contrastive language image pre-training, shortly CLIP, and contrastive live-on-out boost, CLUB, have been demonstrated to be highly proficient in learning transferable representations when trained on image and text data. These models are able to extract meaningful features from the two data modalities by assigning high similarity for fitting image-text pairs and low similarity for unfitting ones. CLIP is based on the info and C loss, while CLUB is enhanced with modern Hopfield layers and uses the so-called info-loop objective. Motivated by this, we propose a CLIP-CLUB objective-based model to learn joint representations of the two retinal imaging modalities. And we further analyze how, after contrastive pre-training, the encoders can be used on downstream tasks. Here we mainly focus on the OCT encoder. A single fully connected layer is added as prediction head, and we perform both linear probing and fine-tuning experiments. The contrastive pre-training is performed using large-scale data from OptimaLab imaging datasets consisting of image volume pairs of patients diagnosed with age-related macular degeneration. For external downstream tasks, we use the Harbol trial dataset. After contrastive pre-training, if we visualize the fundus image and OCT volume embeddings using TSNE to gain insight into the latent space, we can see that the representations of the two modalities are nicely intertwined, indicating the method's effectiveness. We can also define a retrieval task where, given a fundus image, we aim to retrieve the corresponding OCT volume based on the cosine similarities. Both contrastive models, in our case, achieved above 10% top 1 accuracy, which is very significant since this task is close to impossible for human experts to perform accurately. Additionally, we define three downstream tasks on the external dataset, namely central subfield thickness prediction, best corrected visual acuity prediction using a threshold corresponding to the Snellen equivalent of 20/60, and high treatment need forecasting defined based on the number of injections the patients received during the study period under the treat and extend regime. Our results show notable improvement using the pre-trained encoders over the kinetics baseline across the different downstream tasks, especially in the linear probing setup. This proves that the found latent representations are meaningful and can be easily leveraged for other clinical tasks. So these techniques offer a promising direction in integrating information from the two imaging modalities in ophthalmology, and further analysis in diverse datasets and tasks will have to be conducted to evaluate the full potential and limitations of the approach. Finally, I would like to thank my collaborators from the Medical University of Vienna and Johannes Kepler University, the Austrian Science Fund for supporting this project, and thank you for your attention.